See my screen okay? Can I get a thumbs up? Right. So the title of this workshop is Building Effective Community University Partnerships for Food as Medicine Research. And this is a workshop sponsored by the Community Engagement and Implementation Science Task Force. And we have had the pleasure of reading many of your protocols, and we're really inspired by the amazing community engagement that you are all doing. I feel like we only got a taste of it by reading your protocols. We understand there's so much more behind the words on the page in terms of your community partnerships. And we really invite you all to share that today. We are more here as facilitators in this space and less as teachers in this workshop. So to get us started, while we do our introductions, I'm hoping you will put your name and whatever your affiliation is in the chat so that we can start to get to know each other. And I really hope you will use that chat to share experiences and ideas with each other. Okay, AHA has a disclaimer to get started. Okay, moving on. All right, so as you start to put your names in the chat, and I will open my chat up, I want to be sure that we introduce ourselves so you know a little bit about us. So there are three of us, and I'm going to ask each person to introduce themselves. So first, I'm going to ask Leslie. She's a professor of neurology at Northwestern and has some community engagement leadership roles there as well. Leslie, can you give a brief introduction, please?
Absolutely. Thank you so much, Lisa. Hi, everyone. I'm Leslie Scaleras. I am a stroke neurologist and professor of neurology at Northwestern, where I'm also the vice chair. I currently co-direct the Community Engagement Core for Northwestern CTSA. I'm sorry, co-direct it with Darius Tandon. And my own research has been focused on community engagement in stroke prevention and stroke preparedness. I think I'm handing it off to Jen.
Thank you.
Thanks so much. I'm Jennifer Wu Baidao. I'm an associate professor of pediatrics at Stanford. I'm trained as a pediatric gastroenterologist and a health services researcher. And I'm also associate chair for clinical research, which means non-basic science research in my department, so a broad kind of catchment. I have several projects on food security interventions and community engaged research in maternal infant health equity. And I'll turn it back over to Lisa.
Awesome. Thanks, Leslie, and thanks, Jen. Yeah, we are so lucky to have Jen now here at Stanford. We did not intend to have this be a Stanford heavy workshop. When we started, Jen was on the East Coast. So anyway, my name is Lisa Goldman-Rosas. I'm an assistant professor at Stanford and as well in the Department of Epidemiology and Population Health. And I also lead our Community Engagement Core for our Clinical and Translational Science Award, like Leslie. I also work in our Community Outreach and Engagement program for our Stanford Cancer Institute and our Alzheimer's Disease Research Center, and do a lot of food as medicine research. So super excited to bring those two worlds together today and talk with you all. All right, so without further ado, I will get us started. So as I said, we really hope to hold this space as an opportunity for us to share practices around community engagement and recognize that you all bring a tremendous amount of expertise in this area. So our goals are to provide some information and resources to support equitable and sustainable bidirectional partnerships with community partners around food as medicine research, and then provide some opportunities for networking and dialogue around those topics. Now, I know that for this particular initiative, user-centered design has been a really important focus, especially for the food as medicine interventions themselves. And so we recognize that that's important and something you've all been thinking about, and of course share as many methods and principles with the idea of community university partnerships and community-based participatory research, but that is what we will focus on today, the latter. All right, so we really just have three main areas we're going to talk about. First is kind of the rationale, and Leslie's going to take us through that for developing sustainable partnerships for advancing the science of food as medicine and supporting ultimate policy change in this area. And then Jen will talk about strategies for strengthening and sustaining those partnerships. And like I said before, we know many of you bring long-term sustainable partnerships to this work, and the research that we got to read about is really an outgrowth of those partnerships. And also recognize that as your science evolves, you may be thinking about adding additional partners. And then finally, the last area that I'll be talking about is offering up some opportunities to think about evaluating partnerships and kind of improving those partnerships over time. Of course, not because you have any problems in your partnerships, but how can we really advance the science of community university partnerships for food as medicine research? All right, so I will pass it off to Leslie. And I guess before I do that, we have some green boxes throughout the presentation that are really indicators to you that we hope to hear from you in the chat about your ideas, and hope that you'll be able to really use that as an opportunity to share practices. And then as well, I'll be monitoring your beautiful photos. And if you want to raise your hand and share, please do. Okay, and you don't have to raise your hand. You can just shout out. We're a small enough group. Okay, all right. Passing it off to you, Leslie, and you can just tell me when to advance the slides.
All right, terrific. Thank you so much. Yeah, I second that. I think basically we're volunteering our time for you folks. So please use whatever we can do to make this useful for you. We are more than happy to. Next slide. Okay, so I think just to start off at sort of the base level, and given when we read the proposals, it seems like some of us were at sort of very different stages in what community engagement is. So just so we have a common language of what do we mean by community engaged research? And this is community engagement is often a collaboration between institutes of higher education and larger communities for the mutually beneficial exchange of knowledge and resources in the context of partnership and reciprocity. When I look at where you folks are from and what you're doing, I suspect you're doing lots of this already in other aspects of your life. So maybe some of you have worked in policy, done public health policy or health policy. Maybe you're teaching workshops or doing service learning. Maybe some of you are providing clinical care at free clinics or those serving the underinsured, medical missions, even thinking about community service, so coaching, volunteering at food banks, volunteering at after-school tutoring sessions, things like that. But what we're really focused on is community engaged research. And we like this slide because it has all these sort of different names that people call community engaged research, and they're sort of one-offs of the same thing. Sometimes I think, like implementation science, there's often things that have that are very similar and called different things. So we tried to list them here in this box. Next slide. We know that most of you have existing partnerships, but we wanted to take a moment today to think about, have you think about your partnerships and think about what who is present now and who might need to be present as you move on from sort of the pilot stage of your work to the next stage. So when we think about partnerships, we often think of these 7 Ps. So patients or people impacted by the condition or the situation that you're focusing on, providers, purchasers, payers, policymakers, and product makers, and then the research team or principal investigators. Next slide. Jen, Lisa, and I brainstormed to think about, okay, well, who are key partners in your initiatives? So we think about patients, particularly for the user-centered design principles, but it can also be broader than that, obviously. So thinking about healthcare providers and staff, food system leaders and staff, county public health departments, state public health departments, payers, so maybe local Medicaid health programs or other payers, and then policy experts or policymakers to finally do that sort of fundamental upstream social determinants of health change that we're all trying to enact. Next slide. So when we think about who those partners can be, I think we think that there's sort of two ways to think about it. One is this 2x2 table, thinking about interests and influence. So obviously people who are uninterested and have no influence are less ideal to be partners on your project. But thinking about, can you take somebody who has a lot of influence but is uninterested and, sort of move them up into that corner right box of the very interested, very influential person? That would be awesome. But I think that the most of the time, I think our community advisory boards are converged of people with a lot of interest in the topic at hand and variable amounts of influence. Then moving to think about the diagram on the right with the stakeholder partner mapping. We want to start with those that are most affected by the problem, condition, or situation that we're focusing on. And then sort of bridging out from there to think about, okay, who else is affected or has personal influence over the problem? So thinking about family, community, other sort of community organizations that may also be impacted. And then taking a step out further, that who are the gatekeepers, decision makers, and change agents, whether this is policymakers or clinic administrators or local government or city government or state government or activist organizations, thinking about food banks in this situation. I think those are sort of this third level. And then sometimes you want to engage experts who are external experts because they have knowledge about the problem, but they may not be partners. So these are sometimes folks with a specific expertise, maybe a big data or something like that, when you're trying to influence policymakers that may also be beneficial to think about in partnerships. Next slide. So we included this slide to think about how partners are involved at different stages of the research. So we think that you folks have you've gotten through some of this, right? So you've done the pre-research and proposal development where you've thought about, okay, we're going to do food as medicine, but what are we going to do in that? What is our priorities? How is this relevant to our community and our partnership? Then you've also thought about the infrastructure, like how do we make it happen? How do we make sure that it's equitable among our partners? How do we share power and decision-making within our partnership to set up a strong partnership such that the partnership is sort of a living entity that sustains itself sort of within this project and then beyond this project? Thinking about then how do we design our study? So who's most at need, or who do we think we could most benefit? How do we ensure that there's cultural appropriateness and that we have the cultural humility to recognize when we need to sort of readdress things or rethink about things? What's a research methodology that is the best fit? Are we going to do a qualitative study? Are we going to do a quantitative study? And then all the decisions that come after that. How do we implement our studies? This is where I think that most people think where community engagement lives, but my thought is if there's one take-home message today, it would be it lives throughout the research cycle. It's not just like how do we recruit patients or participants, and I think that that's kind of my pet peeve of community engagement is what is like it's all about recruitment, and it's certainly not. There are many things upstream and many things downstream of recruitment that we also need to think about. But recruitment is one of them, and how to retain participants. How do we collect data? Are we going to do virtual remote collection? Are we going to go in-person home visits, clinic visits, thinking about what's the setting and the environment? What's the analysis? So how do we perform the analysis both for academic teams but also for community teams so that it's relevant for our community and for policymakers? How do we get that information out? Again, dissemination is often sort of happening at the end of projects and often an afterthought. I get it. It took a lot to get to this stage. Now you're kind of thinking about the next step, but sort of trying to focus on if the results just live within the community and academic team, we've really done a disservice. So thinking about how do we disseminate our findings to to both the community and partnerships? And then finally, what is our next, what are the next steps? How do we formulate our next research question? And how do we really sort of move from these pilot studies that you folks are doing to having a larger, to future and larger studies? Next slide. This is a slide to say it's okay if you have small community partners and community advisory boards right now, because you're really sort of in this pilot stage where you're assessing acceptability, feasibility, relevance. These are, many of your community advisory boards are probably staffed by are probably have less policymakers, but more CBOs working with food agencies or people with food needs, which that perfectly fits for the stage of the study that you're at. Then moving on to thinking about, well, what's next? What do you, I'm sure that your dream goal wasn't just to do these pilot tests. So like what happens next? And then it's thinking about, you know, how do we do implementation? How do we scale up what we've learned in our pilot studies to these now larger scale studies? And then finally, ultimately, we're all wanting to address, you know, make policy changes to ensure equitable access to food and resources and address these upstream social determinants of health through policy and practice. Next slide. Okay, so this is my example. Oh, I think I put some like annoying, just, you can just call them all up. I didn't think that I wasn't going to be running this. Okay, maybe go back one. So, so this is me looking very young. This is one example of a community engaged project that we started in partnership with Black churches, focusing on stroke warning signs and the importance of calling 911. The photo that we're eating, we're at a Bob Evans, which is like a sort of diner place in Michigan, has like really good biscuits. And we would meet there every 2 to 4 weeks because we're totally broke. We have no money, and we just had a lot of passion that we wanted to really try to improve, increase stroke preparedness. We didn't know how we were going to do it, but we spent a lot of times at that sort of corner booth at Bob Evans. Next slide. And so this is what our community advisory boards look like now. It's like much more professional. There are there are people, you know, across multi sectors. You know, as we roll that pilot intervention that we did in partnership with 3 Black churches out to a whole community, but like it certainly didn't start like that by any means. Next slide. And these are, you know, for that study, these are our partners. So we worked with faith-based organizations, educational organizations, community-based organizations, barbershops and beauty shops, more faith-based or community-based organizations and senior centers. So sort of the partnership network expanded, or ecosystem expanded greatly based on the needs of the project. But I mean, it started out with like one academic partner, us, and one CBO called Bridges into the Future. And then we built this whole infrastructure. So I think sometimes I just want to say it's okay if you have a partner or two at this point. Like, I think the partnership needs to fit the needs of the project. Next slide. I think that's it. I'm going to hand it off to Jen.
Thanks. Okay, so the title of our session was in an interactive session. So now's the part where we're going to get interactive. So if you're in a location where you could either unmute yourself or use the chat, get ready to start interacting with us. Next slide. We're going to talk about strategies for strengthening and sustaining partnerships. So I want you to take a second to think about your project. You may have many different projects with partners or stakeholders who are not primarily researchers. So I think, you know, think about your AHA project or your most recently funded AHA project, if you have many, and where are you on the spectrum of engagement? And so you can see here an example of a way to think of frameworks of community engagement presented by the CDC, where at the more kind of basic level, the engagement is focused on informing. So this is where researchers may just kind of provide some information to the community. So this is often called education or outreach. More increasing in intensity would be a consultation. So this is where you're actually going into the community, obtaining feedback from community members on design, implementation, analysis, and dissemination. With a next level of involvement, you would be working directly with community partners. And they're maybe part of the project, they're involved in the project, you're considering their input. But the researchers are still really kind of leading the design and implementation of the research. Next would be a collaboration where there's a more equitable partnership with the community. That would mean that they're involved from the beginning, defining the research topic, having some decision-making power. They may be more involved in things like the data collection and definition of outcome measures, what's actually being done in the study. And then kind of how CDC at least defines the most intense level of community participation in research is defined as empowerment, where the community themselves is empowered to initiate the research, and they really are taking the lead in many phases. So I'm wondering for you, if you could either raise your hand or just unmute and speak up, or put in the chat, where are you at in your current spectrum of engagement with your AHA project? There are no right or wrong answers here. We're just interested in getting a sense of, are you at the inform, consult, involve, collaborate, or empower? Are you in an empowered situation?
Our group, this is Ryan, but our group is working in Stockton, California with a community partner. This group previously has worked before with this community partner, and I would say we have a quantitative and a qualitative aim, and I think the quantitative for sure is more on the consult side of things, and we've tried to get a little bit further along this line into the involvement with our qualitative aim, and just did our cognitive interviews for our semi-structured interview with our community partner representatives. And I think it's something that we're talking about as a group as I'm sure many of us all are here, about how we can continue to move up the line.
Thank you. Thank you for sharing. Someone said in the chat they're collaborating or empowered with some partners, and with some others they're involved. So a whole different range depending on the partnership and maybe the methods. Next slide, please. So we're interested in hearing, if they're kind of thinking about this as a bit of a brain trust. There's many different people on the call who are probably going through similar experiences with you. And we wanted to pause and see if people want to talk about, how's your partnership organized, what's working well, are there any challenges that you're facing that you have questions about for this group on how to address them. Kalsiana, please feel free to unmute. Thanks.
Yeah, so I would say depending on what project we're working on, we are either in like a collaborate or empower stage. With our partner for AHA, they, in collaboration with some of the other researchers on our team, kind of came to the conception of having a food pharmacy that was co-located with our medical centers, because we've been doing work with them for the last 13 years now this year. So it was really, a joint kind of idea to open that. I would say that and I wrote some of this in my like project report that I was submitting. So we've recruited 173 of our 210 people as of, actually 174 as of this afternoon. But that pantry was supposed to be kind of like permanently opened by our partner in this space, and they've had kind of repeated construction delays. And so we had to open like a pop-up satellite pantry. And originally there was supposed to be like a pantry manager that was funded by the pantry, and then we were hiring like the food resource coach and a part-time student research assistant. And what has actually happened is that the food resource coach has been made the pantry manager. So this person has been put into like 3 different roles. And then I've also had to hire like 3 part-time additional student research assistants to support because the partner hasn't been able to hire like the student interns that they had planned to hire. They do have like funding for this satellite pantry, but they're kind of holding it until they open like the permanent pantry. And so I'm just like trying to think about how well, for one, like we're ending up having to prop up so much more of this than we ever anticipated, both like financially, but also mentally and emotionally. And I feel like this is something that we don't always talk about in academia, like this reality of doing community engaged work too. And a lot of times we talk about like us taking advantage, but there are some situations where like we are also being taken advantage of at times. So I think just kind of, I kind of just wanted to maybe just even get that out and share that perspective, but also thinking about when we're going to do like cost analysis, how we're breaking some of that down, because there are kind of I mean, we will be kind of thinking about how much extra time and whatnot went into it. But I feel like what we're going to find is it's more expensive than we anticipated because of these costs, and how we balance that with like, okay, well, once the pantry's actually open and we have like these AmeriCorps interns that have a little bit of a lower salary than like our student research assistants, for example. I don't know, just thinking about how I'm going to quantify all of that. And yeah, sorry, that was a lot, but I'll stop
No,
now.
thank you for sharing. So, I mean, I heard you talking about kind of like the partner capacity and existing resources. Also, just like funding and how funding is budgeting, I guess, is planned in advance. And also you mentioned the kind of mental and emotional maybe aspects of it. You know, you have this project, it's a passion project, you want to see it happen, and maybe it creates a bit of stress. I want to acknowledge that. I wonder if anyone has any input or advice.
Hey, I just want to add, I'm Kelsiana's partner in this work, and I've had my camera off because I have a parade of middle schoolers coming home from school camp right now, and there's just a lot of things to tell mom about. But anyway, I think the biggest challenge in part for me, having been working with this partner for nearly 10 years myself, is that they have so many irons in the fire. I'm not even sure that the leaders are aware of some of the very on the ground challenges that we've had with some of their staff, and knowing how and when to escalate is a struggle. And thinking about learnings from 2 of my other big community partners on unrelated work is, but also in the kind of food as medicine space, in more clinical innovation space, are faith-based organizations. And I have 2 extremely large faith-based organizations that I'm working with in South Dallas, and they have almost they want us to operationalize programs and then be very hands-off about it. And I find it takes an enormous amount of advocacy to get their attention and engagement once something's off the ground. And they just say, we're so happy with these programs, keep it up. But they don't necessarily want to remain engaged. They just want to be able to, have that program. And so I think there's such a struggle when the partner, you want more of their input, but they don't necessarily have capacity or bandwidth, especially at the highest levels of leadership. And so you're left navigating a lot of the ups and downs.
Yeah, thanks for that. I think one thought I have, and I'm going to touch on this in a couple of slides, is using partnership agreements, if that's something that you have, and thinking about, those can be iterative, and if you can get to the higher echelons of the organizations and have them involved and make it clear, kind of who's providing which resources, and if things are not falling into place, that could be an opportunity, like, hey, I want to revisit our partner agreement and like where we're having some troubles. Thank you for bringing that up. One other person had their hand raised. I think we have 2 more minutes for this section. Daniel Walker, I think.
Yeah, thank you. I maybe perhaps a little bit of a similar comment. One of the things that I think is really challenging is limiting what we ask of the partners. That we have at this point now built many projects with the same partners, and that it's going well, but we want to continue to build more, and they function on a very different model that we have. So we can support some of their staff time. Well, once you start getting a little, they don't want all their staff time supported on your research project. They've got their own staff to do things. And so how many research projects can we do with them? And, we want to do this, and there's other faculty at the university that want to do things as well. And so it's like, how do we organize from our academic institution to the same community partners when it's a lot coming from a tight team, but there's a whole university of faculty who want to work with similar partners? And like, how do you I think related to the first comment, like, you feel a lot of you put a lot of work into those partnerships, and you feel a lot of ownership over them, and so it's like you want to be cautious of that, and I think at the same time also support others. So I don't know, it's a tricky balancing act.
So I'm hearing, you can tell me if I'm hearing right, that you've had a lot of very successful partnerships with a particular maybe organization or group of partners, and people are seeing that and hearing about it, and they also are trying to kind of tap in.
Yeah, so it's both. It's our team has other projects we want to do, and so now you're not just doing one project, you got 4 projects going. So it's that success that others see and say, hey, we want to work with that partner. Maybe they're going to work with us too, but maybe they have their own relationships, and you don't own those partnerships. You've built those relationships. And so I don't know. I feel like it could be.
Yeah. So how do you sustain your partnership and like be generous with others without breaking maybe your being able to continue to sustain your relationship? Do people have thoughts on that? So hearing a lot of people kind of hear you. Yeah, I guess one thing I can think of is like, could there be co-learning? We'll get into that in a second too, that involves helping maybe the partner figuring out how to navigate these types of requests as well, and like them being able to think about, what they have capacity for and don't. Okay, next slide, please. Thanks, everyone. It's really interesting. I love seeing the chat going. So we wanted to point out that there has been some, not a ton, but some empiric research that's been done on this concept of what are best practices, what makes a partnership successful and sustainable. So Patricia Rodriguez Espinoza performed a large kind of multi-site mixed methods study looking at the different predictors of something that she defined as like personal outcomes. So a lot of times we think about our research outcomes, but she had this kind of theory that that how we do CBPR could result in not just partner, CBPR outcomes or health outcomes, but also improvements in individual kind of outcomes for the people who are part of the partnership. And so she looked at a number of different things, and found that things such as partnership relationship processes really kind of predicted how kind of sustainability and long-term outcomes. And then in another kind of more theoretical building study published in 2022, structural governance and we're still on the same slide. Structural governance and a commitment to collective empowerment were also kind of new characteristics brought up as being part of the theory around community-based participatory research that's been often overlooked and should be kind of incorporated into our thought process. You can go to the next slide. So some of the key domains that Rodriguez-Espinoza found were really related to personal outcomes are shown here. So the context, what's the partnership capacity? We heard some of that now. Does the partnership have what it needs to work effectively? So does the community partner have the skills and the expertise that the researcher is hoping that they have? What's the diversity of the partnership membership? Is there a connection with decision makers? Also, a lot of this looking at the partnership relationship processes. So things like democratic decision making, making formal agreements, such as a memorandum of agreement or some sort of memo of understanding. Are the resources shared? This came a lot up with financial resources. So is there any type of democratic decision making in the budget, and how resources or funding are shared with the community? Someone who is actually stewarding the process forward as well. And then influence. Do the partners have influence over decisions? And is the research leadership being responsive to the community needs? And then also, in terms of the intervention and research domain, involving the community, I think, like Leslie mentioned, not just in recruitment, but actually in all of the different components of the intervention and the research. So such as design, data collection, which could be an opportunity to actually do some co-learning and personal capacity building. That one of the kind of qualitative stories talks about a community partner staff member who gets inspired to go on and pursue a degree. And also being able to involve community partners in data analysis. So like in particular, qualitative methods might be a good place. I've heard of several groups that involve the community partners in like coding and analysis for qualitative methods. Next slide. So some ideas for strategies that we kind of came up with, this iterative engagement in activities, working together to develop shared values and mission statements, what are shared goals of the partnership, being transparent and using equity for resources, including, again, financial resources. It sounds like this group is very, very generous with their financial resources. Also, like we talked about, this idea of the partnership agreement, have a formal document that's iteratively updated, would reflect the evolving needs of the community and the academic partners. Also, as new partners come into the project, remembering, you might launch all your agreements at the start of the project. New people come in, you have to remember to also do the agreements with them. And then as things evolve in the project and new components are added, remembering to update those agreements as well to match, really use it as an opportunity to think about, where are we at? How are things going? What types of resources might be needed on, both sides of the agreement? Again, gives other things that could be done are to engage in co-learning. So sessions on financing, policy, food systems, research methods, and then also having decision-making power and being clear about how that's done. And then remembering to involve partners in all the phases, including, as publications offering the opportunity to have co-authorship. Are there any strategies that you think that your partnership could engage in? Now thinking back about these conversations and these ideas, if you can put in the chat, if you think there's anything you might want to add in your partnership, please share it with everyone. Next slide. In terms of the partnership agreements, things that you might want to think to include in them is, what is the purpose of the partnership? Naming kind of who's the leadership, what are they responsible for? How much time are they going to spend dedicated to these responsibilities? Do they have the ability to make decisions on their own? What types of things would they need to run by the project leadership? What are the deliverables? How is the organization? Are people meeting in work groups? Are people going to be in committees? If they're in a committee, how often is it meeting? For how long? In what modality? Having a pretty extensive engagement plan that outlines the decision-making authority and how conflicts are going to be resolved can also be helpful, and that could be included with your partnership agreement. Who owns the data that's being collected? Who's going to be able to use it in the future? Again, research dissemination, and then turnover. This is an important one. What's going to happen if the PI or a research team leaves? What if a key person leaves a partnership? How are things going to work? And then also resources and dissolution. This is something I hadn't really thought about before, but so thank you, Lisa, for bringing this up. How and when is a partnership going to end? And how are you going to close things out? Or how, maybe it'll evolve to another project, but for this particular project, how's the partnership going to dissolve? And then evaluation. How are you going to assess the partnership? How are things going and work to make improvements? Thanks. I'm going to turn it over now to Lisa.
Wonderful. Well, Leslie and Jen, thank you so much. And thank you to all of you for your ideas in the chat. So the last topic we're going to talk about is methods for evaluating and really evolving our partnerships over time. And very likely some of you are already doing some of this or components of this or are experts in it, and we'd love to learn from you. For me, this has been an area that I've been really interested in for a long time and have been really pleased to see how many advancements there's been in methods and ideas for doing evaluation of our community partnerships. So sometimes it's hard to dedicate resources and time to doing this when we're really focused on evaluating the food as medicine intervention. But I can say from my experience, when I have been able to do this on an annual basis, or perhaps, I can do a pre-post survey on every community advisory board, I have learned a tremendous amount together with my partners and been able to use that information to really improve our partnership over time. I will get started with talking about evaluation, but I want to point out this article that's at the bottom. I really feel like we're in an era where there is a proliferation of options, tools, instruments for evaluating community university partnerships, and there hasn't yet been a ton of consolidation that would help us feel like, oh yes, I know exactly what tool I should use to evaluate this or this aspect. So this article that maps out all the different options for measuring community engaged research has been helpful for me. And I'll point out some additional resources at the end. And as I'm talking, if you have any that you really liked yourself or used, please put that in the chat. So we can think of kind of 3 areas of evaluation for evaluation of community university partnerships. So the first is context, conditions under which the research is being conducted, and considerations for effective collaborations between researchers and community partners. The second is really the process, and probably we do more of this, how the engagement is getting done. So community advisory board meetings and so on. And then outcomes, are we really achieving our intended impacts? So talk a little bit more about context. So this has to do with the capacity for community engaged research, both among community partners and among the researchers. Strengths and resources in the communities could be around social capital, social networks, researchers' knowledge and understanding of the community, expectations and goals for engagement, and then specific logistics of an engaged project maybe before it begins. In terms of process, these are some of the areas you could think about measuring. So group dynamics within the partnership, perceptions of influence and power, respect, trust, and communication among all parties in the partnership, the extent to which processes utilized within the partnership align with the goals of community-based participatory research, if that is your orientation to the research, partnership synergy or enhanced collaboration among partner members, satisfaction with the organization and structure of project meetings, leadership for the engaged research, which Jen mentioned is an important aspect, assessing the effectiveness of leadership and outlining governance decisions. And then finally, outcomes, which is maybe what we want to jump to and maybe the most challenging. So you can think about two buckets of outcomes, so partnership outcomes and health outcomes. So in terms of the partnership outcomes, benefits and challenges of participating in the research among researchers and their partners, systems and capacity changes. So we're often seeking to build capacity in our among our partners for conducting research. Improved community capacity, so beyond even our immediate partners, sustainability of the partnership. So Jen talked about how we need to talk about, how our partnership ends, but perhaps sustainability of the partnership is a desired outcome. And then of course you can look at publications, policy revisions, and so on. Now for health outcomes, I think in our studies as researchers and sometimes with our partners, we're really focused on that immediate health outcome that we have identified as our primary or secondary outcome. But as you start to iterate on new and larger projects with a partner, it can be helpful to think about tracking those larger health outcomes that you may be pointing to, which may be more related to structural changes or policy changes. So one model that you may be familiar with and that has been very helpful for myself and my partners in thinking about measurement for community-based participatory research in particular is Nina Wallerstein's CBPR conceptual model. And I think you could teach a whole class or certainly multiple classes trying to take apart each component of this model. But for today, we can think about the 4 buckets, which kind of align with what we just talked about in terms of what we can be measuring for our partnership. So first has to do with the context, which we already talked about, but that can be related to social structural context, the policy context, the importance of the health issue. In our case, policies supporting food as medicine, potentially the food environment, things like this. Partnership processes, so that has to do with individual characteristics of those involved as well as the partners, and then the structure of that partnership, right? Whether you have a community advisory board or how that partnership is implemented. Then we have the intervention and research, both the processes and the output. So that's very clear to us in that box, addressing the food as medicine intervention that you're talking about. And then ultimately, what are our intermediate and long-term outcomes? And I think it's exciting to think about these long-term outcomes that our smaller projects are building to, right? And it can help motivate partners to really track those over time in addressing some of these, more social, political, and structural issues. So here are a few tools just to put it into practice, because I know it can be overwhelming in terms of sample tools that I have started to use. So when you're thinking about evaluating your advisory board, there are some useful tools from PCORI, such as the Patient and Clinician Advisory Committee evaluation tool. So this can assess topics such as size and composition of your community advisory board, number of meetings, perspectives from community advisory board members around their level of influence, and the degree to which engagement principles are at play. Then in terms of the larger partnership, so Engage for Equity is a set of tools based on the CBPR model that we just presented. And that is there is a long version and there is now a short version. And there are actually two Spanish versions, a short and a long one called Fuertes that can be used when you're working in Spanish-speaking communities. The Research Engagement Survey Tool, or REST, is another one, and the Community Engagement and Research Index, CERI. So these all refer to kind of capacity building assessing capacity building within the partnership. And then there is institutional level surveys, which may not be as relevant for food as medicine projects in particular, but groups like Clinical Translational Science Awards and COE groups and cancer centers are increasingly looking at these institutional surveys. And since you will get access to these slides, I linked some of these tools here on the slide. So first actually is a compendium of measures from the National Academy of Medicine that came out. This is for assessing meaningful community engagement for clinical care, but also for research, and you can get access to many of these tools there. The Engage for Equity survey that I just mentioned, that's based on the CBPR model from Nina Wallerstein and her group, is available through her group at University of New Mexico. The PCORI survey that I mentioned is linked here, so you can take a look at what a survey looks like for evaluating your community advisory board. And then here's the link for the CERI tool, which is one that we have started to use. So that is the last slide related to evaluation. I want to open it up now. We have just a few minutes left for questions that can be related to evaluation or comments, but also related to the other topics as well.